Good afternoon and welcome to UnitedTV. My name is Kemal Erkan. Today is November 22nd, 2024. Today we are gonna continue to cover different topics that we always do in terms of our main focus being healthcare, and then U.S. economy, U.S. politics, and global affairs. And with the channel being at over 80,000 subscribers today, we take this responsibility very seriously and try to make sure that things that we do here with our team and our employees, our patients, we want to make sure that we provide the most accurate information. And of course, we are trying to have some fun as well. So the fun part is as we go live every day, this is a recorded event, so then it stays there. What I mean by that is everyone wants to know what we discuss 2 months from now. They can go back to one of these videos and see what we said and we didn't say. Now, I will make a little confession here. So I actually do take an really extra pleasure of saying I told you so. I'm not going to lie to anyone because people are not, sometimes we overestimate individuals, people, and then when we hit 80,000 viewers, I remember in the beginning when some people really didn't think this was going to be at this point, this level. So and that's where we are with this channel. But also, when you look at our predictions and what we have said, what I have said in the past, and what has happened, as Sarah McMahon says, I'm the king of prediction. I'm gonna own to that, and then make sure that our future predictions will be also as accurate as possible. Speaking of that, last week Anthony Anugu was with me, and we discussed Trump cabinets and his initial picks on different positions. And if we can bring Mr. Gaetz, Matt Gaetz, what we have said, and I actually kind of went back and then checked to make sure that I said it, so that I can, this I told you so comes with a dance as well, but I'm going to leave that to Trump. So what I said was he has to be really smart when he makes these decisions, so then people that he picks are not putting him in trouble. And Matt Gaetz was a wrong name. The name, regardless of what his position with these sexual harassment cases and other issues, his name was too dirty to be considered as Attorney General. Attorney General is in charge of the entire legal system, and you cannot bring someone who is not so clean to that position. Now, yesterday, he actually stepped down and he's not the nominee anymore. Now, the other thing that I mentioned last week, after these follow-ups, I have a good overview of what we are doing with some of the other examples in healthcare-related stuff, but I just want to finish these follow-ups. The other thing that I said, when you put people in charge for making things less wasteful, then you cannot have two powerhouses for that position. That would be Elon Musk and Vivek. So those guys, the problem is that's not going to work out. Why I say that is because they're not cut for that position. So, and I don't believe they can efficiently do what is being expected from them. And I think this is going to probably go against them, as they can actually really do a good job independently and, as an advisor to Trump. But rather, he actually almost like an insult. Like, I personally wouldn't want to be in those positions. So the only position that I would probably take is Secretary of State, Secretary of Health, maybe. But rest is, these jobs are not something that you can be just appointed from outside. Some of them requires knowledge, experience. And both of these guys are lacking from the government standpoint. So government is not a toy. You cannot really just do whatever you want to do. It's not going to work. Now, another interesting thing that we just witnessed this week is Linda McMahon is being the nominee for Secretary of Education. So once you see the picture, I don't probably need to say much because the picture says it all. What the hell is Trump is thinking? What the hell is happening there is very interesting. I expect him to make smarter decisions. And this is almost like, is he actually making fun of people by, nominating these people? She is the queen of pro wrestling, like the wrestling or the cage fight or whatever they do. I mean, she's probably corrupt. And if I was in Trump's position, I would probably keep my name clean, because especially as Trump himself has already enough problems at the individual level. So you would think that he would try to bring people who can actually really support him through this 4 years. Now, one of the things that I see many people are not also understanding, we are not really criticizing this or that party. I don't really care about if it's a Democrat or Republican. What I care about is if they do a good job, this country actually benefits from it. And if they do a bad job, we are all suffering. So when I see someone who's going to be in charge of education and she has zero qualification, and I don't think she even has proper education, and you are going to be in charge of this huge country's education, that's a joke. So we expect better from people. That's why we are sometimes disappointed, and some disappointments are bigger because we trust them. And then you would think that Trump, as a good businessman and former president, and someone who ran a really successful campaign, he would stay away from these, really kind of easy mistakes to keep his name and his team clear from any kind of allegation. So one of the things that I'm thinking also is that maybe he's doing it because maybe he wants the distraction, so then he's able to do other things on the side. Who knows? But we'll see what's going to happen in the future. Now, Mehmet Oz, this is where my biased opinion may come in. Although I did not support him when he ran for the Senate in PA because he didn't reach out to us. And I know his dad very well. His dad used to come to our cardiology office, and I would help him. Mustafa Oz, very nice guy, funny, who was also a physician in Delaware for a long time. For someone in Mehmet Oz's position, not to reach out to us when he was running for a campaign, to me personally, because I could have helped him a lot, then I knew that there were issues with his campaign and his decisions. And then things didn't happen. Now he's being the Trump's pick for CMS administrator. So he's going to be the next CMS administrator. Now, Mehmet Oz is a TV personality. He's a showman. So he's a doctor, but his main business comes from TV. He's worth probably 120 to 150 million. This job that he's being nominated for requires, again, education experience in the government that can actually, someone can understand how government actually works. Now, one can say, well, how are we going to actually make reforms? But you don't want to F up the system while you're trying to make a reform. This organization, CMS, the budget is 1.5 trillion. So that's 1.5 times bigger than the country Turkey. So bigger than most European countries, bigger than most countries in the world. So this is a 1.5 trillion dollar responsibility. And just because you're a doctor doesn't mean that you know what's happening in that. And he's actually out of touch. And although he's Turkish, and I'm kind of, on one hand, I'm kind of proud of him being the nominee. I wish that he was able to run a better campaign in PA and then become the senator there, but that didn't happen. And lastly, this picture of, I don't know how much McDonald's is spending on promoting their brand. Now, again, maybe today is the confession day, so I do eat McDonald's. Maybe after today's Bariatric Friday, I will be probably eating McDonald's, but I won't do it in public because I'm a healthcare executive. So, but I also won't do this if I'm someone like RFK Jr., whose main foundation is anti everything that we do today, but him sitting down and having McDonald's in a private jet is kind of very interesting. Almost again, like, are they really trying to make fun of us or trying to entertain us? Hopefully the second one is the case. So, because I don't think this picture is a good representation of what he's trying to represent. Now, at least when I'm eating McDonald's, I'm on an intermittent fasting for 18 hours. I bet he's not. So we'll find out what is going to happen. Now, this is kind of like capturing what has happened since last week. And then because I'm going to be traveling in the next 2 weeks, there will be of the live events, there will be still some videos we are going to post. And when we come back, we have some confirmed events. Oracle Health CEO Dave Feinberg and former CMS administrator Seema Verma is going to be with us on January 3rd. So we're trying to actually get Chris Buccini. His brother was with us last year. I met Chris the other day at Starbucks. Very nice guy. A little bit maybe more social than his brother, but I think both are like they're great people. They do a lot for Delaware. So Chris is going to be most likely joining us sometime in January. So today, my main focus for us is to kind of have an overview of things that we are doing here at UnitedTV. And why, as a healthcare executive, I have to spend this time prep plus the live times, and then surgeon Dr. Erkan, who's driving here. Like, we spend time and we invest in this in a way that this is important for us. Now, our goal is reaching out to individuals who we serve. Because we are a healthcare provider. We have about 180 providers just in Delaware. And then with our clinical integration work that we have done and we are doing, we have different responsibilities to public. So the issue is we need to make sure that we also make everyone understand what we are doing. So this is the best way to do this. This channel is a voice of everything that we do. Now I get sometimes these criticisms like, "Hey, you're a healthcare provider. What the hell are you doing with the economy and politics and global affairs?" Well, the answer is pretty simple. Simple in a way that what we are doing as a healthcare provider today is different than 10, 20, 30 years ago. Unless we have a really good understanding of social determinant of health, we cannot really efficiently deliver the care that we are providing. Now, what is, when we look at the social determinant of health, what we are talking about is economic stability, housing and environment, food security, mental health and social context. These are extremely important for us to, especially when we are trying to do preventive care, or we are trying to follow up with someone after the hospital discharge. We really have to understand what may be happening on the other side would be the patient, to see if do they just need a regular phone call to hear from someone that, hey, are you doing X, Y, Z, versus do they really understand what that patient may be going through? Now, this actually, one of the focuses on this is as we are trying to close this bridge, close this gap with this bridge, the empathy is we are trying to make sure that our providers, our employees are building so that they can do a better job when it comes to providing care itself. Now, I actually want to kind of share a couple things. Because social determinant of health, when it came up as an issue or topic, maybe 2 or 3 years ago, we already have 2 social workers, 5 dietitians, but more like social workers who are not really common in organizations like ours. And when we actually start working with them, our understanding also kind of changed how they are able to help. Roxana and Carla, they were with me in these live events once or twice, and we meet them on a daily basis, how they're able to make a difference when we are trying to get something for patient to be something that needs to be completed by the patient. So that's when you appreciate the experience and education that each individual has. Now, the empathy issue is, I think, one of the really important ones. And this is kind of, I'm going to try to explain this. And if I get questions or if I get comments where this needed to be elaborated later on, we can. But one of the things that I want to just share why we do politics. Well, at least in the United States, our state and federal level politicians, they're lawmakers. They actually decide what needs to happen, how it needs to happen, when it needs to happen, and they make these decisions. Like the state senator, Brian Townsend, he sponsored a primary care bill, primary care reform. Well, he's a lawyer, and this is a primary care bill. So unless we are involved and we work with, we follow the politics, how would we know what type of changes are coming to our way, right? So we want to be able to have a good we want to be able to have a good understanding of what they are doing. And also when they are wrong, we want to be able to communicate that in a timely manner. Now, it's some of these legislative movements can happen very quickly, and some will take time. Just this week, as we are following the politics as a healthcare channel, a good friend of mine, someone whom I supported very much, kind of was on the hot spot, Sarah McBride. So Sarah, 34 years old, young, intelligent, beautiful individual who was put in the hot seat. And although she stayed away from all these specific agenda, one cruel woman on the other side of the aisle didn't even care what she may be feeling or what her family would feel. And someone who's at the level of Sarah, intellectual and smart and everything that she is and she represents, this person that was sent to the Congress to represent her people, this is the other side, Nancy, it will come to me, the name Nancy someone. So she's making a bathroom problem. She's saying that unless you're a biological woman, you cannot use the women's bathroom in the Congress. First of all, I mean, I would probably just curse, but because it's a business channel and sometimes my employees don't like hearing me cursing, so I'm not gonna say what I really want to say. But I think just shame on you. Like, I'm going to be using it as a substitute, but I really need a stronger, something to insult her. How shameful someone can put this one person um, who is where she's today and never run a campaign on trans agenda, and then every time, even when she was, put on defense, she came back and said, "Hey, my issue is not the bathroom. My issue is representing the state of Delaware, Delawareans." So you deal with this type of person, and then there's this trash is just going after, and then she's sponsoring a bill for this. And believe it or not, some people are able to support this. That's not the environment that we want to live in. Now, my issue is not the political side of this, but what if Sarah is our patient? I don't know if she's or she's not. I never checked, honestly. But what if she is? So now I'm going to call and then ask her to do her annual physical. Let's say one of our care coordinators. But if Sarah is going through this type of a social issue, she's under a lot of pressure, and maybe this can even depress her. If it happened to me, I would be like, I would probably hate everyone. But like, I'm calling in and saying that, hey, like, would you like to schedule your physical? I'm like, no, not really, right? So that's where we kind of have to follow through these to better understand, because this is Sarah with a high profile. But what if it's not Sarah, who doesn't have the same power and same influence? Another trans Bray who's actually going through this. Another person. I run hospitals in this country, in Delaware. Two big groups, Hospitals of Delaware and Christiana Medical Group. Then we opened a practice in Bay Health and St. Francis, almost 40 different hospitals. And it was one of the probably biggest one at that time. And I know just 12 years ago, what I'm about to tell you, one of my Indian female physicians was yelled by the patient that she cannot see her because she is brown. So one of my Black doctors in 13, 14 years ago was asked to leave the room because he couldn't see this white patient. Now, I'm not making any, I'm not making any statements. I'm just telling you what happened. These are on the hospital records. Christiana Hospital would have them. You can call Janice Nevin and ask her if I'm not telling the truth. Imagine the level of this racism. Now, that person becomes my patient, that physician, that provider, that nurse. If I don't understand the foundation of racism, and there are people who may be this way or that way, how can I really help these individuals who need the most help? So this is, one of the reasons that we follow through all these things all together. Now, if we were to go to a less maybe popular example, but popular in a way that it may be more frequently seen, but not as popular as Sarah's issue. But there's a single mother with 3 kids struggling and live paycheck to paycheck, and our office calls that person and says, "Hey, you need your mammogram." Well, she not only she doesn't have time, but she doesn't have money to do that. Now, if we just have this cookie cutter approach and then just tell people that, hey, you just need to do this because that's what the insurance or what the government wants you to do. No, like, you really need to understand what the economic issues are. So then if you don't follow the country economics where we are, then you may not know, if you are out of touch, you may not know what the patient may be going through, right? So she's going to worry about getting these kids ready for school, or if they're not at school age, is she going to worry about taking care of them preschool, going to her job, not getting paid enough, child support, and X doesn't want to pay this. I mean, just when in that situation, you get this cold call saying that, hey, you haven't done your mammogram. And then if you don't have the empathy and understand what may be going through on the other side, you can't really do your job. So this is why we actually explain these to our care coordinators to make sure that they have a good situational awareness, and not just. And then this is also how our social workers are also educating our patients and us as well. So now, let's make our examples in just multiply them. A young father with a family and have 2 kids with no job. And then again, calling this person because he didn't do his blood work or annual physical, or they are 50 years old and then they need colonoscopy. Now, colonoscopy is required at age 45. So let's say he's 46 and then he's home looking for a job, doesn't have much available out there. And this person, you need to, as a healthcare provider, you need to know, number one, what's happening with this person in their home, but also you need to also know what the country is going through, and can we actually, make any changes or make any impact on individuals who are running this country, right? So this is kind of like where we, these are the reasons that we have to kind of cover and focus on these. So let's give you another example. A child in a food desert. What that means is a 10-year-old in a low-income urban neighborhood, inner city, no access to fresh fruit, vegetables, and then they're just on a high-calorie diet with like unhealthy junk food and other stuff. So, and what's going to happen to this person with obesity and prediabetes? And if we don't know that environment, if as a healthcare provider, if my organization doesn't understand, then how are we going to be able to really customize what we are doing for that family and for that child? So, another example that you can actually see, as we have, by the way, all of these patients, we have examples of them. A homeless veteran have a lot of issues already, untreated PTSD, physical injuries. And this person, now we are treating this person just like if he was a high middle class, 38-year-old family with 2 kids with a great job. And we are trying to do the same thing for this individual with the same method, same approach. That won't work. And that doesn't work. So that's why, again, I need to know that this individual exists and that there are individuals who are similar to this are there, so that I know when I reach out, I can do things in a different way. The family torn by medical bankruptcy. I mean, if you end up having some emergencies at Christian Hospital, you may end up having a $50,000 to $75,000 bill. Even for some straightforward surgery, it may be a lot of money. So if they put you in collection, they can ruin the family. The pregnant team, if I don't know what's happening with this lady who's 15 years old in the rural Seaford, doesn't have access to the things that she needs, and then I'm calling to see, hey, you didn't get your school physical. And she goes, hey, I'm pregnant. And your parents know this, or does the father know, or how did this happen? Like, if you are not prepped for these, you can look pretty stupid. So, and then you call yourself a healthcare provider. That would not be, that should not be the case. The elderly woman in isolation. Now, I live close to Wilmington. I'm in Wilmington, but close to the city. And we have a couple high-rise condominium units. Some of them are wealthier than others, but I see those elderlies every day. And there's one right after our office on the other side of 95, and sometimes I see them sitting, even if the weather is nice, they're sitting outside. They're lonely, number one, they're in isolation. They have some friends from the same building maybe, but they can help each other because they're all in need of different things. And, if I'm trying to get this patient for Medicare wellness visit, that's the dumbest thing if I don't know where they live, how they live, what conditions they are in. So we're going to do this at a different level. So that is kind of like, those are the reasons, we have to kind of really better understand, and so then we can actually make adjustments on the approach that we have. So there are people out there. I see some of these individuals. They may be, at a different level in their life. They may be, they may be fit, or they may be, they may take care of themselves better, and then blaming everyone else who are not able to do what they are able to do. That's one of the other reasons that we have this, because that's not reality, and those people are just evil. Why? Is because they don't have they are lacking empathy, so they don't know what you may be going through. So I, for prep for this event, I had to kind of read what Sarah McBride's mom actually wrote. So I'm not going to read it because it's going to make me way too emotional, but you can Google it and then read this. This is on the NIH website. And she actually explains her process as a mother and her husband, what they went through during that process. And if you don't understand, and if you don't feel for this, you should really recheck whether or not you're a human being. So, or a good human being, or maybe you are what is soul. You sold your soul to the devil. If you don't understand this, so you don't have to support, and you don't have to be the, you don't have to promote, but you have to understand. You must understand what people are going through. You cannot be just sitting in your, isolated corner and then just judge people and then not have the empathy, and then call yourself a healthcare provider or call yourself a healthcare worker. So that cannot be the case, because reality is, until it hits you, until the issue becomes a household issue, it doesn't have to be that way. You don't need to really understand something until something bad happens to one of your kids. So this is life, and life is for all of us. So that's why we need to kind of better understand and follow these things to make sure that it is, it's not just the life that we live in, but it is everyone around us, who we have access, whom we have access, some we don't have access, and see if we can actually build that bridge and close that gap and better understand. So that's why we are criticizing certain things, and we are covering. Why is the global affairs important? Just think about it. Like just last week, Trump administration said, hey, we're not going to participate in the World Health Organization. And then Anthony helped us to kind of go through that process, saying that, hey, those numbers are actually not the real numbers. And then I came back to you guys and I said, look, when you have 800 different military bases in 80 different countries, or 700, whatever that number is, and you are not able to understand what who, like the World Health Organization, can do, so then you really cannot have a good understanding of what the impact of that decision. So Trump shouldn't be so irresponsible. Look, I acknowledge what he has done. Like, you like it or not, he ran a very successful campaign, and Democrats did a miserable job. Yes, this is the case. But then Trump, which I said the same thing last week, he needs to do things in a smart way, like not in a popular way. Spending 3 hours in a cage boxing arena is not where I want to see our president. Is it popular? Yes. Is it going to get you some, support from some group of people? Yes. But the reality is that's not everyone. So you still have to try to represent all people as much as possible, because half of this country didn't vote for you. And I have said the same thing for the Democrats when they didn't give a choice to Democrats to decide who's going to be their presidential candidate, and then they were just given one person, and we criticize them as well. So the thing is, if you are average, you're kind of a little bit more than the average, then you can kind of see things, and you don't have to be just. It's not a football team or basketball team that you're just a fan of. You have a brain and use it. And your brain, usually, if you have one, usually it's in the middle of Democrats and Republicans together. So that's why you have to kind of keep that mindfulness and common sense, so that you are not becoming a militant, some radical extremist on each side and making things so ugly for rest of us. And 85% of this population wants one thing, and in one way, most likely. And that's can be done by Democrats and the Republicans together. But if we don't understand it from the healthcare provider standpoint, obviously things are not going to happen. And then remember, these are only for 4 years. So if you want to make an impact, you want to take advantage of this 4 years. And if you are there for a show, then you have 4 years. So this is what it is. And it's kind of like what I want to say before we take a break for this month, and then I'll be back in 2 weeks. We may have a Turkish episode, but I do have a wedding to attend, so I don't know if I'm going to have time. But we'll be back second week of December, and we have some confirmed guests, and we'll continue to do what we are doing for this channel and for our people in Delaware, in the United States, and in Turkey. So, well, thank you for following us, watching us, joining us, and we'll be back in 2 weeks. Thank you, and have a great Thanksgiving. Next week is Thanksgiving, so hopefully everyone will have a great Thanksgiving, and holiday season episode with Dr. Erkan is going to start in 15 minutes, so we'll be telling you how to eat. So don't miss that episode, and we'll see you soon. Bye-bye.